Hello everyone and welcome to part 4 of the recall based questions. So this slide was given and the history was given like farmer who is having trauma injury and is a cauliflower growth over the leg like this. These are the cauliflower growth like on the legs, and in this histology copper penny bodies are seen. You can see copper penny bodies. So and branching hyphae are seen. So the answer is chromoblastomycosis. This is the typical features. All the features are suggestive of that only. So that is the answer. See cauliflower growth. Now dimorphic fungi with the red color rivers, and this fungal infection is seen in HIV positive male. So which of the following organism is there? So Teleromyces marnefi. This is the answer. It is seen in HIV positive cases, and with it is a dimorphic fungi with red color rivers is seen. Now, vaginal candidiasis, which medium is used to identify the species in vaginal candidiasis? Options were SDA agar, brain heart infusion agar, and chrome agar. So chrome agar is used, and it is the answer for this question to diagnose vaginal diagnosis species. Now, a 12-year-old boy came with right upper quadrant pain and icterus and fever, and examination shows tender hepatomegaly. And there is no history of dyspnea, hematuria, bloody stools, and there is a conjunctival suffusion is there. That is present to with the 12-year-old boy. So the options were leptospirosis, chikungunya fever, and dengue hemorrhagic fever. But the answer is leptospirosis because this triad is seen with jaundice, with tender hepatomegaly, and with splenomegaly, with conjunctival suffusion. This is seen in leptospirosis. Now, military person with a rash on the body and sparing the palms, soles, and lice present on examination. So this is easy that the organisms were Rickettsia provexi is the answer. Provexi, not typhi, not acari. Now, best investigation to detect Clostridium difficile. See, this is the options were GDH and toxin assay, GDS assay alone, and aerobic culture of the stool because it is seen in stool. So GDA and toxin, GDH and toxin assay. This is done to best investigation to detect the Clostridium difficile. This otoscope finding was given with the history of in the question child with hearing loss for 2 months, and this in this otoscopic finding we can see fluid and air bubbles. So fluid and air bubbles, these are seen in the otoscopic findings of serous otitis media. That's a SOM. Now, an adult male in restaurant who is conscious and sudden choking on food on having food. So what maneuver is done? So Heimlich maneuver is done. That is the abdominal thrust. That is done. Options were abdominal thrust like Heimlich maneuver, chest thrust, and blind finger incision. These are not done. Chest thrust is not done. Abdominal thrust or Heimlich maneuver is done. Now, Samster triad was given in which rhinosinusitis with polyposis, asthma with NSAIDs intolerance was given. So, which drug is needed to be avoided? So, aspirin is avoided in Samster triad in these triad because it is also known as aspirin exacerbated respiratory disease AERD. So, this is very important, and you need to remember this for further exams also. Now, which of the following is not included in WHO STEP approach? So, behavior, psychological, physical. These three were included, and the therapeutics, these are not included in the WHO STEP approach. See, behavior, lifestyle, and substance use, exercise, diet, these are inclusive in the physical and biochemistry measurements, physical and biochemistry measurements, these are all included, but therapeutics are not included in WHO step approach. So this is the part 4th, and stay tuned, more parts are coming and more questions are coming, so stay tuned. Thanks.